So, good afternoon, good morning, good evening from wherever you're joining us from. Catherine here from Thermography Clinic, and today I have a very special guest that I'm so excited that our schedules finally aligned that we could have her on. And I want you to meet Jodie Tatlock, Naturopathic Doctor of EASTND I here in Moncton. So happy to have you today, Jodie. Thank you for joining us.
Thank you so much for having me. It's really exciting to share about the clinics that I have and the services that we offer. So I'm always really grateful for the opportunity to chat about them.
Absolutely. So let's get started because there's a couple of really key topics I want to talk about today. But first and foremost, let's talk about the locations you have and the services that you offer because there's so many fantastic services that you do offer. And I want
Yeah.
to make sure that my listeners understand what those are. So let's dive into that first.
I own EASTND I. It's a naturopathic clinic. It's really encompassing a self-care lifestyle, and the services that we offer sort of fall into the way I like to describe it is our four pillars. So we have naturopathic medicine, we have our acupuncture services, we have IVs and injections, and then we actually have holistic medical estheticians who offer microneedling and facials. And I love having that part because I definitely like the beauty aspect of self-care, but I like it to feel a little bit more, you know, beauty from within versus just kind of a superficial approach. So we really pull in our naturopathic doctors to make sure the internal world is being treated when we are doing our skincare services. So I love that. But the vitamin drips are probably the top of my list in terms of being my favorite service. So we
Mine
have the
too.
yeah. We have the Moncton location, and we're spread out over two um, locations in Moncton that are very close together. So our main clinic is on Alma Street downtown, and it's a beautiful building where we do have our naturopathic doctors and our IV services. And then just around the corner, we actually expanded into a house because we weren't all fitting properly in our one location. So we have an old historic home, and we do more of our med aesthetics there and our acupuncture services there. I sort of call it our tranquil environment. It's really, really relaxing in there. I mean, Alma's relaxing as well, but it has a little bit more of a medical feel, whereas the house is a little bit more of a spa vibe.
Yeah, and it is beautiful. I was there for osteopathy, and what
Amazing.
a beautiful place that building is. So,
Yeah, thank
congratulations on the
you.
expansion into that location as well, too.
Thanks so much. And then I should mention we do have a Fredericton location as well. So that came in not just this last October, but the October before. So October 20, what is that, 22?
Me too.
My gosh, my timeline. Yeah, that's when we opened in Fredericton,
Okay.
and all the same services are offered there as well.
Yeah, oh, fantastic. Oh, that's wonderful. Okay, that's really good to know. So, for your listeners that are listening here, we're going to get into a couple of big topics. You already heard Jody talk about some of the services they offer. You can go to their website at EASTND, so EASTND.com, so that you can see the locations.
.ca.
Oh, .ca,
Ah,
sorry.
that's okay. Yeah,
.ca. I'm
.ca.
so used to saying .com.
I
Apologies.
know, that's totally fair.
So, .ca. But so Jody, let's talk about my favorite. And again, I haven't tried out the skincare piece, but I think that
Yeah,
I need
yeah,
to.
yeah,
But
you
let's
give it
talk
a
about the IV therapies because those are something that I just started myself with EASTND. I want to say 6 months ago now. I think I did my three back
yes.
to back, and we'll get into the process of this for people. And then I think today is my fifth or sixth one that I'm going for, and I'm so excited.
Amazing. Oh, good. Good.
Yes. So I won't spoil it, but let's hear your, from the naturopathic doctor's perspective, let's
Yeah.
talk about IV therapy.
So I personally really love IV therapy for vitamin delivery to the body because it's really direct access, right? You're putting the vitamins right into the bloodstream. And sure, some people will prefer, say, doing orally, but there's a lot of people who don't prefer that route because they forget it's not overly convenient. Or maybe they have underlying gut issues and they're not absorbing the things that they are taking. or they end up on a long list of vitamins, and they just find it too cumbersome to be taking so many pills in a day. So offering the IVs is a really nice alternative to some of those pain points that people end up experiencing. Personally, I go through phases where I'm very great at taking my supplements, and then I go through phases where I'm not so great at taking them. But I will tell you, like, without fail, I get one of my drips every single month. So that for me is creating very foundational health, which I think is so important. We know nutrients and a healthy diet is really important for our overall health, but sometimes I don't think we realize the impact of nutrients on our bodies. And so we may not even realize that we have overt deficiencies in different vitamins or minerals or cofactors. So that could be any B vitamin, that could be your glutathione, that could be a fatty acid like ALA, for example. And there are ways to test for that. We actually have a really cool functional test. It's comprehensive, and you can identify all of your nutrient deficiencies. And I have clients who prefer going that route and then starting the IVs in a really tailored way. But some people just sort of start with the IVs regardless of doing the testing, because the standard Myers cocktail is really touted as a cure-all, in the sense that it's repleting the vitamin C, your B vitamins, magnesium, calcium. It's really creating those foundational, like the foundational nutrients for them building, say, your neurotransmitters like serotonin, which makes you feel good, or creating some of the hormones in the body. So when I say foundational, what I mean by that is like nutrients can be on the very bottom. And if you have any deficiencies there that you're maybe not aware of, it will impact your cortisol regulation. That will impact your thyroid production. That will impact your overall hormone production. So if you kind of start at the top and only look at hormones, you're maybe missing a really big piece. Oftentimes with my clients, I'll just even start with the IVs to see, okay, where does that get us in 3 months? What has started to normalize as we built those foundations for you, or built that foundation for you?
That's very interesting. I'm going to just pause there and jump in, Jodie, because you hit on so many key topics, right? So,
Yes.
cortisol, right? Because
Yeah.
we live in a very, so for
Yes.
people who are listening, cortisol equals stress hormone.
Yes.
And, stress hormones can cause so much sickness and disease in the body just in and of its own, which then
Mhm.
domino effect, right? It impacts your thyroid, et cetera. But you mentioned, Jodie, a nutrient deficiency test. So
Yeah.
what is that?
So the one that I personally like to use, it's called SpectraCell. It
Okay.
will measure your tissue levels of different nutrients. So it's very comprehensive. Like I said, it's all of the B vitamins. Like we have 12 distinct B vitamins. Often we hear about B12, for example, but there are a whole bunch of other B vitamins, and we can measure and see not just what's circulating in the blood, but what's actually present at a cellular level, like in the tissues. Because in the easiest way I feel to explain this for people to maybe have a good idea of the comparison is, sometimes we'll go get iron tested in our blood. And a lot of people are familiar with testing iron or ferritin. Ferritin is our storage of iron in our liver, whereas iron itself is what's circulating in the blood. And you can have your circulating iron levels look normal, but your ferritin be very low, and you can be experiencing symptoms of iron deficiency. So similarly with like the B vitamins or glutathione, CoQ10, it actually goes through all of the amino acids as well. So those building blocks for our proteins, all of the additional fats, like I had mentioned, the ALA. I need to pull up a proper chart of all these. It's got vitamin A, D, E, K. It's so comprehensive. In addition to that, the test actually gives you a score for your overall immune function. It gives you a score for your overall antioxidant function. And if you are having a suboptimal score on those two things, the idea is, once you identify your overt deficiencies or your borderline deficiencies and you correct those things, then we start to see those immune responses and that antioxidant response in the body become normal as well. So
Okay.
I find it such a targeted way to
Hmm.
help people feel better, because we don't always need to give someone a diagnosis
Right.
to think like, okay, well, they're not, if someone comes to me and they're not feeling good, but everything's okay, everything's normal, it's not really the end of the line for me. That tells me there are things that just have not been investigated. And we can say, oh, well, you have suboptimal vitamin A, E, you don't have enough ALA in the body, you need more glutathione. And sure, that's not going to give you a specific diagnosis of, say, hypothyroidism or, like some type of disease process, like in the way that we're used to thinking of
Mhm.
disease. But I know that your body is not functioning properly or optimally, I should say, because you have these borderline deficiencies. So I love that approach of functional medicine and really getting down deep into what is potentially creating symptoms for my clients. And like I said, you can really tailor the vitamin drips from there to then correct those deficiencies. Certain things you would use oral supplementation for, even with the vitamin therapy, depending on what does come back. So it's a really tailored approach. It's so customized to every single person without having to put a label on them.
And you mentioned a couple of key things, right? So, the functionality of it. So,
Mhm. Yeah.
again, you have to have dysfunction in the body before you have disease. And
Yes.
so, that's that disconnection, right? So, I'm always talking
100%.
about how is your body functioning? And if it's not functioning appropriately, and again, it's getting to the root cause. So thank you,
Yes.
Jodie, for explaining that nutrient deficiency test, which I will absolutely today when I'm in, I will sign myself up for. I always like using myself as a guinea pig so that I can share my results with people as well too, because it's helpful, right? It's about, I always say it's not, it's like taking the dart out of the dartboard, right? So
Yeah.
sometimes people will read articles or what have you and say, oh, this vitamin is good. I'm going to go take it. Yeah, but that might not be what your body needs. So sometimes I always like share with my
Definitely.
clientele, right? It's instead of throwing the dart at the dartboard, let's test and
Yeah.
let's see what is there. So thank you, because that nutrient deficiency test sounds very, very nice. I like that.
It is really nice. And to speak to my personal test, like my most recent time that I did it, I was very pleased to see I didn't have an overt deficiency in actually anything. And normally when I run the test with my clients, I don't see that. I chalk that up to the fact that I do regular vitamin drips. But what did happen is I did have a long list of borderline deficiencies. And for me, thinking about preventative medicine, if I have this long list and I don't do anything about it, I know in 3, 5 years that those are going to be deficiencies. So I really focus on those borderlines to make sure I'm correcting them, because I feel like that is equally as important. And it was night and day when I started my specific treatment plan for what was borderline, in the way that I felt, like my mental health, my skin, my ability to just feel like I could think clearly. So like I said, we don't always equate, say, having a deficiency, well, in my case, like a vitamin A, C, E, zinc, those things, to maybe being able to think more clearly in the day, right? But when you do start to do it in a targeted way, it is possible that when you replete them, you do feel the impact of that in your day-to-day health.
Right. Yeah. And I'll share with people too a little bit about my experience about doing the IV therapy. So blood work, all looked great, things were good, but I still wasn't feeling the best, right? So I probably have a lot of those borderline deficiencies.
Yes.
And I started doing the IV therapy. And again, for me, taking all the supplements, it was difficult because it's very busy running the clinic and,
Yes.
just life in general. Plus, I also have, a lot of had some stomach issues as well. So it was
Right.
hard for my body to digest. So anyways, long story short, I go and I do the IV therapy and I did just for everyone to know, you're going to do 3 back to back. So one
Yes.
you're going to do for over 3 weeks, 1 a week, which helps to saturate your cells,
Yes.
right? To give you a really good starting foundation. And then you can book your appointment every, 4 to 8 weeks or 6 to 8 weeks, Jody, after that, correct?
Yeah,
Depends.
so I do find everyone's a little bit different, and I'll often educate my clients that you will become the person who's best able to dictate the frequency in which you need them. So after you do the initial series, like you said, and you really saturate the cells and the tissue so they hold on to the vitamins for a longer period of time, from there, people will generally, I find on the way up to feeling better, people don't always necessarily notice, but what they do notice is all of a sudden they get to a day where they're thinking, oh my gosh, I am sluggish again. I haven't felt like this in a while. I'm not feeling good, or my skin's not looking the same, like my digestion is off. What has changed? What's different? And a lot of the times people will come back and be like, you know what? I realized this was the first time I went 8 weeks without getting a drip. And I think that that was too long for me. So next time I'm going to try like 6 weeks as my period between. So really, if you start to go back to how you felt previous to getting the drips, that is such a key sign that you've gone too long for your body's needs, because you should really be able to maintain feeling good for extended periods of time. But maybe at the beginning, you still need increased frequency of treatments. With my clients who are very inflamed or have chronic underlying conditions, assuming the drips are still a safe option for them, because sometimes there are cases where we would say that they are not a safe treatment option. For example, somebody who maybe gets blood clots frequently, we would not go ahead with an IV drip. We just wouldn't think that it's a worthwhile risk for somebody to be taking when we have oral supplementation as an option. But someone with, say, EBV or Lyme, or they've been chronically inflamed or sick for a long time, they may need ongoing biweekly treatments for a much longer period of time. And that's okay and actually worthwhile for them, because it changes their quality of life, and it is a treatment that keeps them going. And eventually, as they're working with one of the naturopathic doctors at the clinic, and you're really, again, getting to a really holistic treatment for them. So like treating whatever it is in the body that's maybe contributing to the inflammation. So the drips are one component of that, but sometimes there's more that needs to be looked at as well. They will eventually get to a frequency that's not every single week or every 2 weeks. But for someone who's generally healthy, you typically can move out to the 4, 6, 8 weeks. But oftentimes our clients do enjoy getting them somewhat frequently, so either monthly or every 2 months, just because they feel really good from getting them, and it maintains that feeling.
Mm. Oh, listen, I'm number one. So I've been doing it every 6 weeks, just so everyone knows. I've been doing it for every 6 weeks. And it's interesting because a week ago I put in my calendar that when I go there today, I'm bumping it up to every 5, because I notice on that 6 week, which is what I'm in right now,
Yes,
the hormonal irritability, or whatever you want to call that, because I am in the middle of perimenopause, I notice a difference. But I've
yeah.
also noticed a huge difference when I added glutathione last time.
Yeah,
And
that makes
that's my
sense.
favorite. So let's
Glutathione.
talk,
Yeah.
sorry, what?
You want me to tell you about glutathione?
Yeah, so
Glutathione.
let's talk about glutathione, and let's talk about, after glutathione, let's talk about some of the different vitamins in drip form that people can get today.
For sure. So glutathione is a major, it's the most potent antioxidant that we have in the body. So if we experience, we run into a chemical in our environment, which inevitably we're going to, and then create stress or free radicals in the body, and then we need to get rid of that chemical from the body. So glutathione is involved in that process, and it's what makes sure that when we do run into chemicals, we don't have that damage turn into something like, say, cancer down the road. And so glutathione is really prevented. If you're deficient in glutathione and you're repleting it, you're really preventing some of the damage that's being done in your body from turning into anything more serious down the road. And so with glutathione in particular, I feel like a lot of people don't necessarily realize this, but you actually need all of your good cofactors. And what I mean by that are things like vitamin C, vitamin E, selenium. There's a whole list, some of the B vitamins like B5, for example. But you need those things to also be in a good state to actually take that glutathione that we give you and make the most of it. So if someone's coming in, we'll typically be doing the standard Myers plus the glutathione, because we want to make sure that they have all their cofactors. What can happen is if you just do the glutathione and you never have done a Myers, you've never supported the other cofactors that maybe are suboptimal in your body, you'll do the glutathione, you won't feel so great. You'll feel a little bit sluggish. You might end up with a headache. And that's often because you're not recycling the glutathione in the body the way you need to be, because it does require those cofactors to do that. So it's really the combination. Glutathione is so, so important. but I'll see people kind of come in and all they're doing is say an oral liposomal glutathione, or all they're interested in is the glutathione alone. And while yes, that's going to boost your immune system, give you like really beautiful skin, make your liver healthy, boost your mood, improve your sleep, it's only going to be as beneficial as the assumption that your cofactors are present as well. So that's something that's really important to know.
That is very important because, again, I'm sure there'd be a lot of people going in and saying, "Oh, I just want glutathione," but
Yes. Yeah.
understanding, right? And it's the same with, with iodine. There's cofactors that you have to do with iodine as well too. So it's very important to understand that. So thank you so much for that. So Myers cocktail, you had talked about this a couple of times and you've explained it.
Yeah.
But for anybody that wants more information, they can obviously research that. But Myers cocktail is there's a lot of information out there on Myers cocktail actually.
Hmm. Yeah.
And we know that we can do glutathione. So what are the other IV therapies, Jodie, that we can get from EASTND as well?
Yeah, so the way that we do it is we use the Myers cocktail as a base for everyone, assuming there's no reason why we couldn't use one of the ingredients. So that would be, like I said, the vitamin C, all of the B vitamins, magnesium, and calcium. And then from there, to really tailor and make it a customized treatment, we listen to the symptoms that somebody is experiencing, and we'll usually do add-ons, or like I explained, we'd either do the testing and we would know for a fact which add-ons they needed. And so that can look like any one of the amino acids. So sometimes somebody will be overtly deficient in the amino acid taurine, and we will replete the taurine. So with our compounding pharmacy, we can order in any of the potential nutrients that we need to add to the bag within reason. There's some rules around all of this, but I won't get into that. It's kind of like a scientific conversation. Or if somebody just tells me they're really anxious on a day-to-day basis and they're not sleeping well, we have the amino acid glycine that we can add into the drip, and it's really relaxing to the nervous system. So much so that people feel it right away. They feel very relaxed right away, and it will last. Like if you're following the frequency that we were chatting about in terms of really getting that cell saturation, you will get a long-term effect of that anxiolytic on the body, or the nourishing effects of it to the nervous system, better night's sleep. So that's another example of something that we could be adding in. What else do we commonly add in? Sometimes we'll tailor the Bs depending on whatever is going on. If it's a cycling woman and she's having really bad PMS, extra B6 is actually very beneficial for that. We do the glutathione, as we were chatting about. Glutathione's special because it can't get mixed in with the other vitamins. So it's either a separate bag or it's given as a push. We have, well, extra vitamin C, so energy levels. There's actually a specific dose that's been studied to affect energy levels with vitamin C. So you get it up really nice and high if somebody's having low energy or needing a boost. And this is really great because those levels are actually levels you cannot take orally. With vitamin C, you will hit bowel tolerance. That just means like if you take too much of it, it sends you to the bathroom. It's not a comfortable experience. Whereas in an IV, when you give it in these nice high doses, it does not bother the GI tract. You don't get that same irritation. So those are just some ideas. It really, I guess it depends on what someone's presenting with, what you would then decide to use.
Right. So one of the other things that I add that I will just touch base on too for women to know is that there is one called CaliCast, and I
Yes.
also have been taking that one as well too to help with hormones. So
Yes.
that has also helped immensely as well. So I really appreciate that.
Yeah.
One of the things I do want to mention is that a lot of people will say, "Oh my gosh, Catherine, I don't like needles."
Yes.
Right? They say
Yep.
a lot. But what I want to share with everybody is this. I don't think anybody likes needles.
No.
However, your lady here in Moncton, I mean, her name just escaped.
It's Madison. She's phenomenal.
She is
I
amazing.
know, she's so good.
She is so good and she is so calm and she is so sweet.
Yes,
However, when she puts it in, I just want people to know this, okay? From my own experience, I giggle every time because it's like I don't feel it.
I agree.
One, it is a very, very small needle, which is fantastic, but she is absolutely phenomenal.
Mhm.
So if you are nervous by any stretch of the means, once you get with her, she will calm you, and she is so gentle, and it's so relaxing when you go into your location, with the nice big chairs that you can lay back in, and a heating pad if you wanted, and a nice blanket if you wanted. It's very comforting. So
You're making me want to go get one right now. That sounds so relaxing the way you're describing it. But
I'm looking forward to 3 o'clock, Jodie.
honestly, Madison, and that's to you saying that, that is not me even just being biased because obviously I adore her. She really is very skilled and makes it such a nice experience. It's funny, I can start IVs no problem, but as the person receiving, I don't get super excited by a needle, but I agree when Madison starts it, I don't really feel anything at all. So that's really a nice, comfortable experience. And it's funny the way you said that, Catherine, because in my consults, I'll often ask people how they feel about needles. And I'm always like, why do I even ask this? No one likes a needle. No one's going to be like, oh, yes, I would love to have a needle today.
And nobody likes it, but I will tell you, you are in great hands with Madison. And I don't usually say those things unless, it's been
Yes.
my consistent experience. And it absolutely is every time that I go in there. So hats off to you guys, and hats off to Madison for creating such an incredible experience for people coming in, because it definitely isn't it isn't that anxiousness that you would get
Right.
if you're going to the lab, right? And you're not sure who you're getting and how it's going to hurt or how it's going to go in.
Yes.
So thank you for that. Any last parting words that you want to share, Jody, on any of your services or anything like that that you want clientele to know?
I guess I'd just like to share that you really can't go wrong with whichever maybe service you do start with at EASTND. Like one thing I take a lot of pride in is the fact that our practitioners really we're so supportive of one another. So we encourage you to go to another practitioner. We encourage you to try another service, or if we feel it really is in your best interest to be doing a different service, we're going to bring that to your attention and have those conversations. So I do feel like that's a really unique experience for a clinic, and something, like I said, that makes me really proud to have all of these incredible practitioners involved in a process like that, so that you just feel like you actually know the service that you're doing is for you, or that the person who's providing it really believes that it's the best service for you, because if they didn't, they're going to direct you to where they think that you would be. So whether that is with the IVs or whether that's with just working, one-on-one consultation with your naturopathic doctor, doing the oral vitamins, or starting with our acupuncturist, or even just starting with our skin services, like our medical estheticians, they want you to have beautiful skin. So if they feel like they can't achieve it topically, they're going to refer you to a naturopathic doctor. So you can't really go wrong, in my opinion. I may be biased there, but I do think you could start anywhere in the clinic, and you can kind of work your way through some of the services depending on what we feel kind of collectively is going to benefit you.
And I love that approach, because it's about the priority of the client,
Yes.
and understanding that maybe they need this naturopathic doctor first with this specialty
Yes.
before you go to number two, because if you go to number two first, it may not stick, right?
Yes.
So I love that approach, Jody. I
And
do.
another thing, even with our naturopathic doctors, I kind of equate it to sometimes you go and you see one counselor and there's nothing wrong with that counselor, but maybe you just didn't connect. And so you're interested in working with another one. I find similarly with our naturopathic doctors, like we're all very easygoing in the sense, like if you come to see us, but maybe I'll just take myself, for example, some of my clients who are coming for really in-depth nutrient support through diet alone, that's not going to be my forte. Whereas one of my naturopathic doctors, Lindsay, it is. So I'll say, you know what, I'm going to start you here, but at your follow up, I want you to see Lindsay, because she's going to get in depth to all the foods you should be eating in a day and really give you the guidance you're looking for there, where that's not necessarily my particular expertise, but it certainly is hers. So you can just kind of move through us as well.
Yeah, I love that approach.
Yeah.
That is totally putting the client first
Yes.
and their health and well-being. So I really appreciate that, Jody. So thank you for sharing that as well. So, okay, for the listeners, again, Dr. Jody has a clinic here, a naturopathic doctor. I have to make sure I say that, sorry.
No, that's okay.
She has a clinic here in Moncton, so two, one on Elma Street and one on Victoria Street,
Yes.
as well as in Fredericton. So
Yes.
again, it's EASTND, and it's eastnd.ca.
Yes.
You go to the website, you can book online, you can give them a call. They're all very lovely. They're very welcoming. And both locations here in Moncton, I've been to both, and very engaging, and I love going there. So thank you so much for creating what you've created here in Moncton, Jodie. I'll have to stop in and see your team in Fredericton one of these days as well too.
Definitely. Thank you so much for having me on and chatting with me. It's such a pleasure, and you are so wonderful. I love being in line with you and everything that you're putting out into the community. So thank you.
Thank you so much, Jodie. Much appreciated. Bye-bye.
Bye.